Hi everyone, I'm Selena Uibo, the Northern Territory Minister for Health, Mental Health and Suicide Prevention. I wish I could have attended today's showcase event for Every Week Counts National Preterm Birth Prevention Collaborative. I wish to acknowledge the Ngunnawal people as traditional custodians of the land on which you are meeting on today in Canberra, as well as the traditional lands of the Larrakia people where I'm recording this message in Darwin. And I pay my respects to the elders both past and present, and the future and emerging traditional owners. As a proud Ngunnawal woman and the mother who has been impacted by preterm birth and pregnancy loss, the work of this national program has been of great interest to me. It was during my very difficult journey that I learned that being born too soon is the leading cause of death and disability in our children of up to 5 years of age. I would like to share a part of my journey for this showcase event. The journey that I've had with my daughter Radiance, who was born in 2020, who will be turning 4 this year. My sons Astro and Orion, who were born in 2021 and 2022, who were preterm births and preterm losses. And my son Phoenix, who was born in August 2023, who is now just gone on 7 months old. It was through some of the distress and the journey that I've had and my family's had where the preterm birth team has been phenomenal here in the Northern Territory. The work that our healthcare professionals have provided, not just to my family, but to many Territorians across the NT, has been admirable. But the work that they are doing now to connect on the national platform is phenomenal. I'd like to thank people like Dr. Kiana Brown, who I met during my personal journey, to be able to support her and our fellow professionals in the preterm space on the professional side is something of a responsibility that I hold dear to my heart. Starting life on an even field remains a challenge for Australia's First Nations babies. We know that 1 in 12 babies in Australia are born premature. And alarmingly, for our First Nations baby, this is a rate of almost double at 15%. Being born preterm can set children up for life of disadvantage with high risks in health, such as diabetes, heart disease, and early death. These outcomes can devastate our families and communities Australia-wide. To make a serious improvement in these outcomes, we need to ensure that First Nations Australians are involved at every level, from policy making to healthcare delivery, with services that are designed with First Nation leadership and governance at the forefront. I'm proud, again, to have people like Dr. Kiana Brown and her team in Darwin and working in the Territory to develop and pioneer the community-driven strengths-based public health campaign that encourages not only First Nations women, but all women to take control of their pregnancy care, to understand important milestones in their pregnancies, and to better engage with their healthcare workforce. I hope that it will provide a roadmap for improved outcomes for all First Nations women, children, and our communities. While there are successes so far, there is also much more work to be done. The importance of social determinants of health cannot be overstated. Remoteness can influence several key indicators for First Nations women, including smoking rates, attending antenatal care, and low birth weights, and also, of course, preterm birth. A workforce and a health system that is capable of addressing social determinants of health, including education, social support, cultural strength, housing, transport, and financial support, can lead to improved health outcomes. It has been extremely encouraging to see all of the work that this national program has particularly emphasised when we're talking about developing community-based community care models and strong representation of First Nations leadership in health. I congratulate all of the key partners involved in this national program, and I look forward to hearing of your continued success. And I absolutely welcome the future support of this program to ensure the opportunity can be positively impacted for future generations.